Hi everyone, welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I am your host and the Dean at the Arizona College of Podiatric Medicine. In past Dean's Chats, our guests have been current leaders in the profession. You've heard from deans from the other schools and colleges. You've also heard from residency directors. We're shifting it up this week a little bit though, and our guests are future leaders in podiatric medicine. My three guests today, Morgan Shano, Kaitlin Thompson, and Wyatt Thielman are fourth-year students that will graduate in May from the Arizona College of Podiatric Medicine. Podiatric physicians, as you know, specialize in the diagnosis and treatment of all foot and ankle disorders. So once they graduate, they will embark on a new beginning, starting their 3-year surgical residency training programs around the country. They will begin the training in July. Last week, we had the match. You've all heard of the match, where students ranked residency programs, and in turn, residency programs ranked students. These rankings are processed in a computer program, and the students found out their destination last Friday. Welcome to Dean's Chat, Morgan, Kaitlin, and Wyatt.
Thanks for having us.
Thank you so much. We're so excited to be here.
Yeah, thank you.
Well, thank you. Just a little sidebar from the Arizona College. We had students match in residency programs all over the country, from Seattle to Portland to San Diego to Florida to Boston to Michigan and everywhere in between. So I'm really excited that you took the time to come and talk with me today, and I really appreciate it. Morgan, let's start with you. On match day last week on Friday, where did you find out you matched at?
I am excited to say I'm going to Presbyterian St. Luke's in Denver, Colorado.
Congratulations. That has been a top program in the country for decades, and I have many friends back there.
Yes, I'm excited to be going back. I spent a couple years there, so it'll be exciting.
Congratulations. Morgan, if you don't mind, share a little bit with the audience of where you're from, your undergraduate experience, and perhaps how you found out about podiatric medicine.
Yeah. So I'm from Gilbert, Arizona, originally born and raised. I went down to Tucson at the University of Arizona for undergrad. And then I went on to do a 1-year master's in Denver, which was at Regis University. And that was actually kind of how I got more of the spark for podiatry. I had an anatomy professor there who knew that I loved anatomy. And so she was like, you should really look into this. And so that's kind of where it sparked. During my application year, I was planning to do a DO route instead, but I was working as an MA at an infectious disease clinic. And that was where I saw my first podiatric patient. They loved their podiatrist. They loved the care that they were getting. And I wanted that out of my patient population, shadowed. And that was how I found out a little bit more about it and just dropped my application from the DO programs and pulled it all for podiatry.
Well, we're glad you did. And I'm glad you liked anatomy, because surgery is really applied anatomy.
Oh, definitely. Yeah.
So let's talk about your 4th year of training, Morgan. Every year we talk to students about applying for clerkships, or sometimes synonymous with externships. Could you explain to our audience what a clerkship is?
Yeah. So a clerkship is basically an audition month that you're going to do at a program that you're probably interested in going to residency. The nice thing about it is that you get to really see what that everyday life is as a resident there, who the people you'll be working with, attending wise, your co-residents possibly, the staff, all of that. It's your opportunity to put your best foot forward and to see what you would gain while you're there, as well as for them to see if you would be a good fit.
Yeah, it kind of goes both ways.
Mm-hmm. Oh, definitely.
So when you started your 4th year, how many clerkships did you participate in?
I did 9 total.
9. Do you mind walking us through where you went around the country and then make a little comment on each one that really prepared you for matching with the Pres St. Luke's program?
Oh, definitely. Yeah. So I went a little bit of everywhere. So I started out at UPMC in Pittsburgh. I picked this program just because I knew it had an academic, very strong academics there, and they were going to expect a lot out of me, which it definitely did. They had long days, just a lot of academics throughout the week. So that was what I needed going forward. And then I went down to Florida from there, and I went to Bethesda Hospital, where, again, a lot of ankles, which I thought trauma was something I was super interested in. And then I went to East Orlando to further go into more trauma and high number program. Then after that, I came back to Creighton's program here in Arizona. My core was there, so I was actually on burn, but also used it as a clerkship in a way because I did get to see some podiatry. And then I went to JPS in Texas. Then I went to PSL in Denver, and then I was at Swedish. Same kind of idea, high academics, high surgical outcome. That was a lot of what I was looking for. Then Kaiser Oakland, same idea. Also, Dr. King had done a presentation shortly before I submitted, so that was a big pull. And then New Mexico VA.
Very good. Well, you got around. Must have got a lot of frequent flyer miles.
I did. The first 3 months flew, and then I drove everywhere else. So,
all right. So, how did those months prepare you for interviews for January? After doing all those months of rotations, you had to go and do interviews around. Did you go to CRIP in Texas?
Yeah, I did. Yeah.
How many interviews did you do?
I did 8.
8?
Mm-hmm.
And at the end of the day, you ranked them, and when the match came out, you went to St. Louis.
Yes, I did. Yep.
Fantastic. Were you surprised that you matched there?
I think it felt not real at the moment. I felt really good leaving my month there, but it's kind of one of those programs that that they expect a lot, and I wasn't sure if I was that. So I had really good feedback, but of course you want it, but you don't know if you're going to get it. So it was very exciting.
And that's what's exciting about the match, of course.
Yeah, exactly.
Are there any recommendations that you would give to first, second, third year students that are anticipating coming up on clerkships that they might not be obvious?
I think just go into it. This might be obvious, but go into it very open-minded. I think it's very easy to get into what everybody has told you about these programs. And so that's where you go in expecting and then it's not. I remember going to some places people had told me that they didn't love, and I loved it. So it's very much so meant for you to end up where you're supposed to be. You will find that feeling, which I didn't know I would during it, but it definitely happens. So just take it for what it is, enjoy it, embrace it. And it'll be a great experience.
What are your thoughts on doing a highly academic program at the end of your third year?
I think it's probably the best to set you up for it in a way, especially if that's kind of where you're trending on what you've picked already. I think that was my idea, I guess, with UPMC, was that I wanted it to get me ready going forward. And then I ended up loving it there too. So, I mean, you think of it maybe as a prep clerkship, and then you end up like, well, maybe this is where I'm going. So you have no idea.
Well, if you think about it, in your fourth year as a student, it's really the only time in your career you're going to get to travel around the country and see what the best of our profession has to offer. So
yeah, exactly.
What a tremendous opportunity. Well, thank you.
Mm-hmm.
Kaitlin, when you got notice on Friday, where are you going for 3 years to do your residency program?
I'm going to JFK in West Palm Beach, and I'm so excited.
I bet you are. So you're trading in the heat of Arizona for the heat and humidity of Florida.
All heat is good.
That's great. Do you mind saying a few words about yourself and your undergrad experience and how you found out about?
So I'm from St. Louis, Missouri, and I went to Mizzou. I actually found out about podiatry when I went to go see one because I was having a lot of chronic pain and injuries with sports. They found I had a limb length discrepancy, and they also thought I had Ehlers-Danlos syndrome, which I actually do have. And so they made me orthotics, sent me off to a geneticist to get diagnosed. And ever since I got my orthotics, my pain pretty much virtually disappeared. So I kind of drank the Kool-Aid early on. Knew I was really interested in lower extremity work. And right when I got out of college, I worked as a medical assistant for my mentor at Foot and Ankle Clinic. And I've never looked back. So
how did you find yourself in Arizona?
So during my interview process, I went to a few different ones and something just clicked here right away. I felt like everything was offered that I wanted. You look at the different board pass rates, successive match, all of that was there. And I left here and I was like, this is where I'm coming. So it was a pretty easy decision, assuming that I got accepted.
Well, we're glad you did. So in a similar vein to what I asked Morgan, tell us about your fourth year. Tell us about when you had the opportunity to start looking at clerkships around the country. What were you looking for?
So I really knew that I wanted a surgery-heavy program with well-rounded academics. So I reached out to a lot of upperclassmen and other podiatrists I kind of know around the country. And I was like, where do I need to look at? What do I need to do to be successful? And that's kind of how I made my list when I applied for clerkships initially.
So how many months did you do for clerkships?
I did 8.
Eight. And did you mind walking us through your path?
Yeah.
Tell us a little bit about each program and how it benefited you and ultimately matching in Florida.
Yeah, so I went all over the country. I started at Emory in Atlanta. I knew it was a very, very strong program. Obviously, they have the Podiatry Institute, so great reputation. So I started there, really felt like they gave me strong bearings of what to expect, how to be prepared for all of my following externships. Then I went on to SSM DePaul in St. Louis, my hometown, which was awesome. Got to work with my mentor some and really see some amazing cases. Saw my first total ankle there. I remember that. And then I went on to Scripps Mercy San Diego. Phenomenal program. Cannot speak highly enough of them. Went on to Creighton here in Phoenix. Also an incredible program. They have so much to offer and so much uniqueness with their burn unit and their opportunities there. Then I went on to JFK, where I will be attending my residency. Then I went to Westside, another program in Fort Lauderdale, Florida. Saw so many amazing cases there, probably some of the coolest I've seen. And then I went to Aventura last in Aventura, Florida, and I cannot once again speak highly enough of the group there. They really have such a wonderful family there. So it was an awesome experience.
And again, it's amazing how you travel around the country and there's so many phenomenal training opportunities. Mm-hmm. It really speaks highly for the profession, because when I think back to 1991, granted, I'm going back years, we had about 550 graduates around the country, but there were only 88 two-year surgical positions. And this year, every graduate from every college and school are going into a 3-year surgical training program. So it really speaks volumes for the advancement of the profession over time.
Absolutely. I love what we do, and I'm so excited and proud of our entire class this year.
Me too. So if I were to ask you to give some advice to students around the country that are anticipating this busy fourth year of clerkship opportunities, what would you tell them?
I do agree absolutely with what Morgan said earlier. Form your own opinions, figure out what you like, because what I thought maybe I wanted at the beginning of them definitely developed as my months went on. Utilize your upperclassmen, reach out to them, especially when it comes to preparing for when you get on to boards and interviews and things like that. And really, really try to get to know the residents there and figure out the ins and outs of the program, what they think the strengths are, what they think the weaknesses are, and then make your own opinions. That's probably my best advice.
It's great advice. And now when we're done a little bit later, let's talk about the uniqueness of interviews, because that's always a kind of a pinnacle of your educational experience. Well, thank you so much, Kaitlin.
Thank you.
All right, Wyatt, it's your turn. What'd you think on Friday when you found out where you're matching? Where are you matching?
Right, lucky me. It was great. I learned I'm going to McLaren-Macomb out of Michigan, and I'm super ecstatic for that in regards to, especially with Michigan and all that, where it's super open to podiatry and all that. And knowing that where I would want to end up potentially too in the Midwest, and what the training offered, well-rounded is what I was looking for. Really fit the niche for what I want to continue with podiatry for my career.
A little side note, and you and I haven't had a chance to talk about it, but I got a note from their residency director, Dr. Andrews, who said he was so excited that you were coming to the program. And I did not know this, but I trained at Kern Hospital, which Civic Kern Connection was the beginning of podiatric surgery in our profession back in the 60s. And luminaries like Dr. Kaplan and Dr. Cannett went there. So it was funny because Dr. Andrews sent me a picture of my graduating class from 1993 at Kern. So he said, make sure Wyatt knows he's welcome back into the fraternity. So
yeah, I'm super fortunate the history that program has, and hope to continue that on and highlight the program as well as our profession in a positive light.
That's great. So Wyatt, tell us a little bit more about yourself. Where'd you go to school? How'd you find out about podiatry as a starter?
Yeah. So I am from Fond du Lac, Wisconsin. Good old Fond du Lac. And went to University of Wisconsin-Milwaukee for undergraduate. Podiatry started for me actually in the 5th grade with a plantar's wart. I've only seen a pediatrician and a dentist up to that point, and I was honestly pretty scared. I didn't know what it was going to take to get this wart off. But the podiatrist, the whole experience was really happy, and I felt like, why would they be happy? It's a wart, like this is the foot, but kind of got me into exploring it as an option, and saw that there was a pre-podiatry track at University of Wisconsin-Milwaukee for me to actually take the science courses and all that to apply to podiatry schools. And I was also fortunate on top of that to shadow the Ascension Milwaukee program as well, the local one, see how the residents work with the director, Dr. Dye there, and kind of get that perspective as well to make sure absolutely I knew what I was getting into. And coming to Arizona from the Midwest, especially trying to even build myself up more, develop more of an independence, get away from home a little bit, it was just perfect for me, bit like a glove.
That's great. Well, I grew up in Wisconsin also. So just a side note, Wyatt and I have been talking Packers and Bucks and local sports to Wisconsin for the last 4 years. So Wyatt, tell me about your fourth year experience. How many clerkships did you do?
I did 8 clerkships. Yep.
Okay. And at the end of your third year, you had an opportunity to do 2. Where did you start off?
So with third year rotations, specifically the local ones?
No, I was thinking at the end of your third year when you have
Right.
a chance to do some clerkships.
Right.
Let's talk about the clerkships first, and then we'll, as a group, talk about the third year.
Cool. So I started off at Loma Linda, VA, and then went up to Kaiser Santa Clara, and then back down to Cedar Sinai, and then to North Colorado, Ascension Milwaukee, Rush University in Chicago, University Hospitals, Cleveland, and then ended at Norton in Louisville, Kentucky. So I drove for all of it. I really wanted to get that full experience. And there was definitely, I think for everyone could say it, during that experience, there's a lot of personal growth and all that traveling as well, getting to see all these different places.
So it's interesting because you all went to different clerkship opportunities around the country. When you were picking clerkships, what were you looking for? What were you envisioning for a fourth year?
It was actually morphing into a different idea every clerkship, to be honest with you. But I also wanted to find something, honestly, at the end that was well-rounded, because at the end of the day, if I really felt like something else would fit me or I wanted to be specialized in something, I could do so because the program would be well-rounded in that fact, or at least put me in the right direction to really explore a specific facet of podiatric medicine I would be interested in.
So what is the specific aspect of podiatric medicine that really turns you on right now?
Honestly, Charcot,
Really?
because with Charcot, I feel like if you can really help that population and make things work on the sides of surgery and clinical aspect, when you have more of, you say, a patient with less comorbidities, that sort of thing, then it's definitely a lot easier to handle, that sort of thing. So it's it's a challenge. It's a lifelong challenge there. I think you're always trying to chase that perfect solution.
Well, I think that's true for our diabetic population, for all of us. They become patients for life. They come to rely on you to help them save their limbs and prevent problems. So I think that's a great area. How about yourself, Morgan? What part of podiatry have you really enjoyed over the last 8 months or so?
It's funny. I started out at Charcot, and then I feel like I slowly started to pull away from that more. And total ankles is something that has impressed me more as I've seen them. I didn't have a ton of experience towards the end with some of those programs, and I could see myself doing those in a couple of years.
Did you get an opportunity to assist on some total ankle replacements?
I did, yeah. That was, I guess, one of the big draws to Swedish, is because you have one of the top podiatrists there who's doing so many of those cases. So I probably was in 1 or 2 a week.
Oh my gosh, that's great.
Mm-hmm.
And Kaitlin, how about you?
I also really enjoy the total ankles and trauma in general. So the ankle fractures, all of that. I like the X-fixes. So that was a huge reason that drew me to JFK, was they were constantly doing those kind of cases. And I learned so much from them during it. And and another thing I just love about podiatry in general is our whole profession. You spend so much time with your patients. You really get to know them as people and kind of be a support system for them in other ways than just their physician. I mean, there's nothing more rewarding, in my opinion, than helping someone be able to walk again pain-free.
Absolutely. Let's pivot a little bit and talk about the interview experience. You all went to the CRIP, right? The Centralized Residency Interview, and it's in Texas. Let's talk about that experience. How many programs did each of you interview when you were down in Texas? Kaitlin?
I did 6.
6.
So I did 6. Most of them were in person. I did have a few virtual ones as well. But yeah, the whole experience in Texas was very interesting. I didn't stay at the hotel, but it was so fun to see all of your friends again, honestly, and everyone. I thought it was going to be a lot more intimidating, the interviews, and it ended up not being so much because you know all of these people on that level and they know you. And yeah, I honestly thought it was a fun experience overall. The first interview I was very nervous for, but once I came out of it, I was like, okay, I can do this.
Did you interview with programs that you did not do a clerkship at?
I did not.
Okay.
Mm-hmm.
Okay, that's good advice for future students.
Yeah, I really, really liked the programs that I interviewed at and clerked at, and I knew hopefully that my home would be with one of them.
Very good. Wyatt, how about you in Texas? How many interviews did you do?
So I did only 3 in-person interviews at CRIP. I did have kind of a phone call set up in December. So also a good note, just have your phone on you during December, just in case people reach out to you early if they do an earlier interview. And funny enough, I don't know if I saw Kaitlin. I saw Kaitlin at her first interview. It was my first interview too, when we were both, I could tell, a little bit nervous.
We were.
But we were all kind of like what she said. We're all in this. We were all in it together. And once you get through that first one, it's really nice to see everybody and that sort of thing. And I like to piggyback off of what she said in that it's also important to kind of definitely go off of what you believe as kind of your top choices and really go gung-ho on that, I feel.
I think that's great advice. And Morgan, how about your experience?
Yeah. So I did 8. I only did in-person ones. But yeah, I couldn't agree more. I loved the process. I mean, it's stressful, of course, because you're interviewing for hopefully where you're going to go for residency. But I think that camaraderie of everybody being in the same boat, you get to go downstairs after you do it and kind of vent and release a little bit and you do it again. So I was very happy it was in person this year. And just to piggyback off of, I mean, you get to see everyone you saw, and it's been months for some of them. Like if your first one's in March, you haven't seen them since then, and just to see your growth that you've done.
Yeah, I think that's important. And I think that's something that we need to acknowledge going forward, because during COVID, everything was on Zoom and you just don't get the same feedback. You don't get the same vibe or the same connections for that.
No, not yet.
Having them in person, I think it was very valuable this year. It's easier to show mannerisms, kind of gauge how you feel. And like she said, see your old friends. As long as you come prepared to interviews, you'll do okay, and you'll have a good time while you're there.
Yeah, exactly.
So let me ask you each another question. What is the most interesting interview question that you had in the process?
I wouldn't say I had any super crazy ones compared to other people, but I did get asked what my favorite animal was and what animal I would be and why. I said a tiger, of course, because that's self-explanatory. They're awesome. But that was probably the craziest one that I got.
Was there a common theme to any of the cases that were presented?
Case-wise, absolutely. I would say gas gangrene, neck fasc, ankle fractures. I did have a Charcot and a pilon fracture, but I would say the prior were kind of the consistent few that I saw overall.
Morgan, how about you? What was an interesting question you were asked during interviews?
I'm bummed I didn't get any that exciting. I think I did have like the typical ones like favorite TV show, why, or something like that. Which that's kind of fun just to see what everyone else in the room responds. They either love your show or they hate it kind of thing. But yeah, the only like the funniest one that I was told to prepare for, I guess weirdest one was the what kind of tree you would be and why. And if you're not a plant person, you really have to think on that one. So
what
I can help you.
I was going to say a palm tree, from Arizona and sunny. They're always blowing. Yeah, exactly.
Can't go wrong.
How about cases? Anything unique that you hadn't seen before?
So I had a GSW case, which, or a gunshot wound without the acronym on that, which I personally didn't get to see while out. So working that up was more just trying to pull from what I could maybe come up with from other cases. So that was an interesting one. Otherwise, very consistent with what Kaitlin said, just with the gas cases, always ankle fractures were probably in half of mine. Or complications associated with anything else they showed.
I did have an accessory soleus case. That was interesting. That was kind of out there.
Well, I think it's interesting because many times the residency interview selection process is such that they're trying to figure out how you think. They're not even necessarily, you don't have to get the answer right, but you got to work the patient up appropriately.
Exactly, yeah.
So I think that's important. How about yourself, Wyatt? How about your interview process? Any interesting questions?
I wouldn't say interesting questions, but I would always give like extensive answers. I would probably say the most crazy, and it's not really, is kind of like, what are your hobbies? But mainly like, what's your favorite type of music? And I would go into a big spiel about being a big fan of like 80s and 70s music. And they're like, well, you're like 26. Why do you like that stuff? And I'd have to explain my love for that and all that. And Morgan and Kaitlin were saying they're really trying to figure out your personality and if you could really glue in with the team for a full 3 years. So I'd have to say that was my most interesting because it was a loaded answer I would give.
So I'm going to fast forward 10 years. And so Wyatt, I'll ask you the first question. What kind of music are you going to be playing in the operating?
I think I'm going to be honestly playing some yacht rock playlist off of Spotify. It's just really nice and peaceful. Yeah. It's like Pina Colada song, some Steely Dan.
Love them.
Yeah.
It puts you in the vibe, right?
Yeah. It's not like I don't own a yacht, but you can dream.
Sure. Right. Dream big.
Yeah. So my next question is, what are your aspirations in the profession, Wyatt?
So aspirations for myself, I already kind of stated I want to go into Charcot, especially. I want to be the Charcot guy. I want to be where people send me kind of the people that have been through tons of podiatrists and they've been trying to find solutions. And I want to be the end point for those people to get them back to the lifestyle that they've been looking for.
That's great. I have no doubt that you will do that. Morgan, how about yourself? Fast forward 10 years. What do you anticipate doing and within the profession, but maybe even as a leader in the profession?
Yeah, I hope to just kind of be having like a more elective, well-rounded practice of some sort, whether that's being a part of an ortho group or a multi-specialty group. That's kind of just what I see myself more in at this point, or I hope at least to be the case. I would like to, I don't know in 10 years, but maybe even further down, I really enjoyed residents or attendings who took the time to teach me these past 8 months, 9 months now. So I see myself probably wanting to go into that role of helping out students who are coming through, maybe getting involved with a residency program. I never thought about that till this experience, but that has been something that's kind of been on my mind a little bit more.
I think the unsung heroes in our profession are the doctors that take on residents and train residents and work with the residents to help them improve their surgical skills. So I think that's just a phenomenal way of paying it forward. Kaitlin, how about yourself?
Honestly, mine pretty much mirrors Morgan's vision exactly. I would love to go and have a practice of some sort, very well-rounded. I'd like to be able to handle pretty much anything that comes in my door. I definitely would love to give back in some magnitude, whether that's teaching a class or being a part of a residency program. I think I would do really well with that. I think there's no better way to give back than doing that and also stay sharp, stay up to date on your knowledge. And then, you're learning from some of the newest, brightest, and you can't go wrong with that. So,
well, I'll tell you, being a clerkship director for 10 years, the students always kept me on my toes.
Oh yeah.
I bet. Yeah.
No doubt. All right, let's shift gears again. Let's talk a little bit about your education at the Arizona College of Podiatric Medicine. I'm obviously so happy that you all decided to come to the Arizona College. But let's talk about the third year. When we really are the rubber's kind of hitting the road. You're getting into clinical opportunities. How did the school do in preparing you for getting out and doing your clerkships? Wyatt, you can go first.
Yeah. So I loved it personally. It was super diverse. Us being at Midwestern, I think we have Phoenix in our backyard. So talk about how much opportunity you have to work with so many different people, get so many different approaches, and really already more fit into your favorite way on how you're going to approach patients already by the time clerkships hit. So for me, I thought that was perfect. Not only was it podiatry based, but you also had the opportunity to do medicine stuff as well. I know there was classmates that did like endocrinology, rheumatology, that sort of thing, and really made it well-rounded. So when we came to clerkships, we could really apply that stuff right away, and we felt prepared from the get-go.
That's great to hear. Any shout outs to particular preceptors?
I would love to do a shout out to Dr. Corley. He was my March rotation, and he helped definitely prepared me and get me in the mindset of how I should think for clerkships, and was a great mentor in regards to just, how it is to be in podiatry, and especially straight out of residency. What is life like? So
thank you. Morgan, your third year experience.
Yeah, very similar. It's kind of nice because every rotation you go to is a little bit different. So you might go to a practice that's a little bit busier, or you're going to go to someone who does hospital work, wound care, and private practice. So you get a really good look at what you could make your future to be, and kind of start to see a little bit more of the opportunities that are within that. I definitely learned everybody does something different. So you learn 7 different techniques, and you'll never know which one they want until you get there and you see how they do it, which is great. Then you get to figure out what's best for you down the road.
Well, it's interesting because those first opportunities in the operating room leave a lasting impression.
Oh, definitely. Yeah.
Any shout outs to preceptors?
Yeah, definitely at Midwestern's clinic, Dr. Curtis and Dr. Kraleski were my main ones when I was there. And they're great. It helps because, of course, they know what we are expected to be knowing and what we should know going forward. But then also Dr. Rand, he treated me like a resident. He expected me to be there pre-rounding on people and go see people on consults in the hospital, bring it back to him. I did all the wound care in the wound care center. He just really showed me what was expected for me going into my clerkships. So
that's so,
yeah.
Kaitlin, how about your experience?
I completely agree with everything they just said. I think that Midwestern does such a good job with the rotations and the variety and diversity you see within those clerkships of preparing you for what you're going to see, not only residency, but, practice potentially down the road. Like Morgan said, you have hospital, you have private practice, you have people that do a lot of surgery, whether it's a 4-foot slam or a rear foot stuff, you kind of see it all, see the different ways of doing things. You see what you like, you get really comfortable talking to patients, managing patients from all different walks of life, and kind of figuring out how you should approach treating them. And I felt like it made me really ready to go out on my clerkships specifically.
Any shout outs to preceptors in particular?
So definitely Dr. Martin. She's been a great mentor to me. And I also think the entire Phoenix VA staff as well. So you're looking at Dr. Perosi, Dr. Lerner, Dr. Stevenson, Dr. Ellsworth, and Dr. Jong are there. And they really prepare you. You're writing the notes. You're seeing your own patients. So you're diving right in and getting really comfortable very fast with acting like a podiatrist. You got to get ready for it.
And nothing like getting thrown into the deep end of the pool,
yeah.
Right?
Oh yeah. It was a great learning experience. And I'm actually with them again this month, lucky me, and still continuing to learn and build on that knowledge.
That's fantastic. Couple last things. Let's talk about your first 2 years at the college. Obviously we had COVID, right? Mm-hmm. So there was a lot of at-home studying. We are integrated with the osteopathic medical program. How'd that work out for everybody in the college? Do you think?
I think it's a huge pro for us as far as getting that academic base, and also networking in general with all these other physicians that are going to be out in the world while you're practicing. I think our curriculum is super solid. I really feel like it set me up for success, and I'm super grateful for that.
Yeah, just to piggyback off of that, I do think the amount of medicine that we learned in those 2 years has been super applicable. I'm on general surgery right now at Valleywise, or our county hospital here in Phoenix, and to be able to hold those conversations and actually seem like I know what I'm talking about. I think there might be that little bit they don't expect me to know. And then it's nice to just have that backing, like, no, I understand these systems. I know why we're doing this. And I think that is something that our school has done a really good job of preparing us for.
I think Dr. Rajan would love to hear that.
Yeah.
I think our general medicine track at our college is phenomenal. It prepares students to be doctors, not just surgeons, for sure.
Right.
Exactly.
Wyatt, your thoughts?
So especially the first and second year, what I loved about it personally is it's kind of weird, but it really stressed us out, and stress became such a normalized behavior for us that when it came to third and fourth year, it was just such a normal behavior in that, and how people kind of responded to us, that I think the grit that we got from first and second year just kept compounding and really helped us in regards to taking things like constructive criticism or things maybe not potentially going our own way, but then getting better from that as a result.
Well, I think that's the medical way, right?
Yeah.
Got to get you used to that. Think about what an honor and privilege it is to do surgery on fellow humans.
True. Yeah.
So I know you all work so hard and very excited for your future. Anything that each of you would like to say to students, prospective students going into podiatry, or current students? Give you a final word.
Yeah, I'm happy to give a few words of wisdom. If you're interested, you can reach out to literally any of us at any time. You will never regret this decision. I've grown so much professionally and emotionally and in all aspects of my life. I would never change what I've done. And you will come out very well-rounded, especially if you choose Midwestern. So,
Wyatt?
Yeah, advice I just want to give out is to definitely just follow your passions and dreams, because it's just that much easier to explore that route and do well at it. And even if you're the only one that can possibly see that dream or pathway happen, continue that, have faith, and know that, as Kaitlin said, that Midwestern's kind of like a really tight-knit family, alumni and all that. So we're all here looking out for each other, making sure everyone's dreams do come true.
That's great. And Morgan?
Yeah, you guys said it great, but I think when you're in it, or if you decide to commit to this, embrace it. I think it goes fast. It's very surprising to think that we graduate here in like a month and a half. So
it's gone by so fast.
Yeah, just take every opportunity, the amount of growth and how much like I look back at what we barely knew anything first year. I didn't know what a bunion was. And, now we get to help, correct them surgically. So just take it all in, soak it up. It's a great field. I am stoked to see where it's going to go. I think it's just going to keep growing. So.
Well, I'm so proud of all of you, and I am grateful for you taking your time to come in and visit today. I am so looking forward to following your careers. I think one of the greatest things for me as being a dean is to watch students who come in, green as can be, graduate, do the residency training, and the next thing I know, you're on a podium, so we're giving a lecture. So I do look forward to following your careers. So thank you again for coming in today.
Thank
we
you.
appreciate you and all of your guidance these past 4 years.
You're welcome.
Lucky to have you.
Well, thank you. I want to thank all of our listeners today for joining us on the Dean's Chat. We will continue to bring you voices and leaders within the profession, but also future leaders in the profession like we did today. We'll see you next week, and don't forget to give us a 5-star rating. Cheers.